Hello, my name is Melanie Mora Romero, and I'm going to talk about the effect of aspirin on cardiovascular events and bleeding in the healthy elderly. Definition: aspirin is a well-established therapy for the secondary prevention of cardiovascular events. However, its role in the primary prevention of cardiovascular disease is unclear, especially in older persons who have an increased risk. Applications in medicine. On the basis of the results of previous trials, it was anticipated that benefits of aspirin treatment might arise from a reduction in the rate of cardiovascular events. However, in this trial, the rate of the pre-specified secondary endpoint of cardiovascular disease was now significantly lower with low-dose aspirin than with placebo. Pros and cons. Reduce the rates of both myocardial infarction and ischemic stroke. The risk of major hemorrhagic events. Issue applied in Ecuador. In Ecuador, there is no record of statistical data of the use of aspirin as prevention due to the cause of bleeding. Conclusion: the use of low-dose aspirin as a primary prevention strategy in older adults results in a significantly higher risk of major hemorrhage and did not result in a significantly lower risk of cardiovascular disease than placebo.
And so they have come out and said aspirin is good to take to reduce risk of heart attack, stroke, and colorectal cancer. But they've been very specific about who should get it. They said your risk over 10 years should be at least 10%. And you should be at least in the 50 to 60 year age group. Once you're older than that or younger than that, they really don't have evidence to say it may benefit you, although certainly the older group we tend to give people aspirin for. Now, the other caveat is if you have bleeding problems. If you've had GI bleed, you've had blood in your stool before, you've had ulcers before, that's a risk. Or if you take lots of what we call non-steroidal anti-inflammatory agents, these over-the-counter medications we buy for arthritis and pain, ibuprofen, naproxen, things like that, that can actually get you into trouble. So they're saying don't take the aspirin if you take a lot of those pills too. Aspirin in a man will lower their risk of heart attack, but not so much lower the risk of stroke. Aspirin in women lowers their risk of stroke, but not the risk of heart attack. And this is in primary prevention, meaning patients that have not had either before. It's all based on risk. If you're high risk, you're more benefited by the aspirin. If you're low risk, the benefit's very low. The second thing that's very good is the risk of side effects from the aspirin, the bleeding from the aspirin. That's very important. Because what most people don't realize is that while our risk of heart attack goes up as we go through life, our risk of bleeding with aspirin goes up faster. So you actually need to be a higher risk at an older age for a heart attack or stroke to warrant aspirin than you do at a younger age.
Daily aspirin therapy can be a life-saving option, but it's not for everyone.
It's important you get the facts before considering that daily aspirin. UVA's Dr. Brandy Patterson explains in this week's Straight Talk MD.
Hi, and welcome to Straight Talk MD. I'm here today with Dr. Brandy Patterson, a cardiologist at UVA Heart and Vascular Center. Now, many older adults take an aspirin to decrease their risk for heart attack and stroke, but a recent study reveals that a daily aspirin therapy may not be recommended for everyone.
That's right, Casey. Just recently, the results of the Aspirin trial were released and showed that daily aspirin therapy may actually be more detrimental than beneficial in some healthy people. So just because your spouse or your friends are taking an aspirin doesn't mean that you should start as well. It's very important you talk to your doctor first.
Yeah. What are some of the current recommendations for daily aspirin therapy?
Well, daily aspirin therapy is really the most beneficial for those patients who have already had a cardiac event, such as a heart attack or stroke. In these instances, aspirin therapy is known as secondary prevention and can help reduce your risk for a second occurrence. But if you are a healthy adult who has never had a heart event, aspirin therapy may increase your risk of gastrointestinal bleeding. Weighing the benefits versus the risk here, aspirin therapy may not be the best option.
Yeah. And I know a lot of us have heard, if you think you might be having a heart attack, you should chew an aspirin immediately. Is that true?
Again, it depends on the person. So your first move should always be to call 911 if you think you're having a stroke or a heart attack. The EMS provider will then walk you through your next steps. If you have no allergies or no risk factors for complications of aspirin therapy, then chewing an aspirin can definitely help prevent the formation of blood clots and limit the size of a heart attack or stroke.
Okay, so it sounds like the main takeaway from this is really just talk to your doctor.
Yeah, that really is the main point.
Yeah, see what's right for you and what's not.
Absolutely.
All right, well, thank you so much. Thank you for watching.
Thank you.
If you are over 70 years of age, rejoice. You have one less pill to swallow. Aspirin. We have the facts.
Pain. Pulsing, throbbing pain. Bayer is the wonder drug that works wonders.
More than 19,000 people in the US and Australia participated in a placebo-controlled, double-blind, randomized trial over the span of 5 years. This large clinical trial concluded that taking low-dose aspirin every day is no longer recommended to most adults who are in good cardiovascular health. Historically, aspirin first appeared in the ancient Egyptian medical text known as the Ebers Papyrus. Since then, the pain reliever, also known as acetylsalicylic acid, has been linked to treat pain, fever, or inflammation. By the mid-1980s, University of Oxford professor Richard Peto used meta-analysis of multiple clinical trials to conclude that aspirin was actually a heart attack prevention drug. And so for years, low-dose aspirin was prescribed as an all-around remedy to ward off heart attacks and strokes. But the recent 2019 study concluded that the use of low-dose aspirin had no effect on prolonging life in healthy, older adults without known cardiovascular disease. It also suggested that the pills could be linked to major hemorrhages. Cardiologist Roger Blumenthal said in a statement obtained by USA Today that clinicians should be selective in prescribing aspirin, and that only select people with a high risk of cardiovascular disease might continue using it as preventive measure. So there are no magic pills and no shortcuts. Doctors say maintaining a healthy weight, exercising, and avoiding tobacco are among the best ways to prevent cardiovascular disease.
So we've had now new data from 3 large trials on aspirin for primary prevention, and it's really an eye-opener that it's not as good as we would have assumed. So many patients say, oh, I take a baby aspirin, and of course if you've had any type of vascular event, an MI or a stroke, that's been clearly beneficial. We know about bleeding risk from any antithrombotic, but the benefit far outweighs the risk in secondary prevention. But in primary prevention, the data are very old. There's a physician's health study, a nurse's health study that showed some benefit, but not a huge benefit, really in the range of like 10 or 12% reduction in cardiovascular events. And a lot of that predated all the aggressive prevention with statins, et cetera. So there have been newer trials. Aspirin looked at elderly patients, and then there was ARRIVE that looked at a broader group, and then the ASCEND trial looked in patients with diabetes. The latter, a huge long-term trial, and that actually did show a benefit, again about a 12% reduction, but it was equally balanced by an increase in bleeding. So for every event prevented from heart attack or stroke, there was a bleed created. Now, it's probably worse to have a heart attack than have a GI bleed. So many of us had said, well, that does open the door for some patients, but we have to really balance the benefit and risk. In Aspirin, they studied elderly patients, and there the risk was far outweighed the benefit. So there wasn't a significant reduction in cardiovascular events, and there was a very significant increase in bleeding with just a baby aspirin. So in the elderly, there had been another study done in Japan in elderly patients, also same story, no benefit and big increased risk, like a doubling in the risk of bleeding. So it's a big caution for older patients, primary prevention, to think about aspirin. And so all of this comes to being, this needs to be a careful decision on something seemingly as simple as taking an aspirin a day, that we realize that we have to make that decision very carefully and are really moving away from it in many populations.
I know. Well, millions should stop taking aspirin for heart health. On the Health Watch tonight, a new study says for healthy people, aspirin should not be taken to prevent heart attacks or strokes.
Health reporter Stephanie Stahl is here with the details of a study just released in the last hour.
Just released, and this is another big reversal here. For years, the advice had been aspirin is heart healthy, but this research says it may be more harmful for some people. Now it is only recommended for certain patients and always only under the direction of a doctor.
I'm sitting there watching TV, go to get up, and my leg wouldn't work.
70-year-old Margaret Ragucci suffered a stroke a few weeks ago.
I was in the 3-hour window for somebody having a stroke, and they were able to administer the medication, and I walked out of here.
Now that she's had a stroke, doctors put Ragucci on an aspirin regimen. It's common for stroke patients, but a new study in the Annals of Internal Medicine finds too many Americans are taking aspirin and don't need it.
Aspirin is not as helpful as we thought it was. That's probably because other preventive treatments like blood pressure lowering and cholesterol lowering have become even more important.
According to the study, 29 million people in the U.S. are taking aspirin for prevention, even though they don't have heart disease, and many are taking aspirin without their doctor knowing. Doctors say aspirin is useful for heart and stroke patients to prevent blood clots, but for some patients, especially those over 70, it can be harmful.
As aspirin can cause bleeding. It raises the risk of bleeding, whether it's from the stomach or anywhere in the body.
Margaret is grateful she received the stroke treatment right away.
I could have ended up in a wheelchair, a lot of very bad things, but thank God we've advanced.
Now with a baby aspirin a day and statin medications, she's hoping to get back to her workout routine. Now, this research just released says about 29 million people 40 years and older were taking an aspirin a day despite having no known heart disease, and about 6.5 million of them were doing so on their own. A doctor never recommended it. So this new recommendation is, unless the doctor recommends it, don't take aspirin on your own, for sure.
Good heads up.
Thank you.